Well, good morning, everyone. Yeah, I know. Washington, D.C., a nice, brisk, cool morning. Let me first welcome everyone here. And we're going to be doing two things this morning. Talking a bit about, of course, one of my favorite topics, climate change. We're going to talk a bit, we're going to have someone to talk a bit about this Lancet report and the policy brief for the United States. We're going to be getting to that in just a bit. I just wanted to point out, if anyone's missed it, climate change is here, and it's impacting our health today. And, I'm an ER doc, and it's always very painful when I have to recognize that there's something that I can't fix. And I've been recently quoted as saying we cannot doctor our way out of this, and we cannot doctor our way out of this. We've got lots of things we can do around mitigation and adaptation to try to address this. But I think our task right now is to try to figure out how to make this a coffee issue, an issue around the water cooler, and for most Americans, a kitchen table issue, so that people begin to try helping to connect the dots. Pictures of floods in Italy, terrible storms, children who are having challenges with asthma, and for whatever reason, storms and fires that are tearing down our forests and making us all sick, hasn't quite made the case for some strange reason. So we have a lot of work to do if we're going to make this something that people can accept and think about as an important issue. So with that in mind, I would like to bring to the stage someone who can talk a little bit about this from a leadership perspective. And that's Congresswoman Eddie Bernice Johnson. Congresswoman Johnson is serving her 14th term, representing the 30th District of Texas, and as a dean of the Texas Congressional Delegation. As many of you know, she's the first African American and the first woman to chair the House Committee on Science, Space, and Technology. Congresswoman Johnson is the highest ranking Texan on the House Committee on Transportation and Infrastructure, and of course the first nurse to be elected to the United States Congress. So without further ado, I'd like to bring to the podium Congresswoman Edith Bernice Johnson.
Good morning. Well, Monday morning, it's a little bit early for me. We normally go in late on Mondays, and I'm usually traveling in at this time, but because of these remarks this morning, I came in last night late. And I'm delighted to see that we have a group of people that are interested in climate change and are not deniers. I hope. For the last 6 years that I have served on the committee, we had a committee of deniers, but those of us who believed that there was real climate change would not give up. However, I don't know that we have to go too far now trying to explain it, because we're all seeing it and experiencing it every day. Being from Dallas, Texas, a couple of weeks ago, we just experienced a very tragic, really, tornado. No lives were lost, and that was actually due to the projections and predictions, but many, many homes were destroyed, multi-million-dollar value. So I think everyone in Dallas, Texas, now believes strongly in climate change. I think that the climate nexus is one of the biggest environmental challenges of our time. And so I would say that everyone here and every messenger here should acknowledge and admit and educate, because we're in for a pretty good ride. No matter what we do today, it's not going to stop overnight, because we did not stop it before we were experiencing it. So these rising global temperatures will continue to have an effect on our economy, but most importantly, our health. Now, I'm told that we should have some very harsh winters coming up, and that might be a good thing, because until we can do something about the increasing temperatures, we will continue to see the spread of many bacteria. And that is a direct impact on everyone's health. I would say that that's probably the most important thing that we should be giving attention to now, simply because not only does it affect us in terms of bacteria in the environment, but it affects the production of food as well, the availability of nutritional food. And so it is critical that all of us become ambassadors, screaming out for attention to the environment, so that we can become leaders rather than national deniers, or a nation of deniers that's represented at this time. It's been very unfortunate for me to observe that we are coming out of the Paris Accords. But all Americans do not agree with that. As a matter of fact, Bill Gates is one of the Americans that's contributed quite a bit of money for research. How we will participate now is not determined, because we're not as a part of it. But at the end of next week, I have been invited to accompany the speaker to Spain for a conference on the environment and climate change, and if the plane doesn't get canceled. But it's very important that nurses, physicians consistently educate and give attention, because we are in for some new experiences, I think, in the status of health, simply because of climate change. Climate scientists have become more willing to speak openly and publicly about the changing climate, and it's really important that the healthcare professionals join that message. It's going to be important to educate the public. As I mentioned earlier, when we have the technology to predict what's going to happen, we certainly can avoid a great deal of tragedy. The tornado we just had in Dallas, not a single life was lost, but the emotional trauma and the material trauma is consistently in line with a great deal of stress, and many people are suffering at a time where we do not even have adequate mental health facilities available for people to seek that emotional support. And so the impact of climate change is global, and we will all experience it, especially when we have 1.5 degrees Celsius continuing to manifest itself. And we need an all-in an approach, and especially from health professionals, because it will be the health of people that we will find many more needs not just emotionally, but also the kind of maladies that people get when the wind and the movement within our environment will be carrying bacteria around the globe and exposing many. Just at a time when we're also experiencing, for some crazy reason, an anti-immunization time. So that's another impact that will come right along with the other. So I am really, though, proud to say that in the committee, we've tried very hard to be bipartisan, and we're trying to address the issues a little at a time, leaning heavily on research. We have brought in the most prepared witnesses that we can find in the world, and so it really has given us a little bit more opportunity to get a few more things done bipartisanly. We have passed several pieces of legislation that touch upon the impacts of climate change and public health. And we've held many hearings focused on climate change, and so that we can get the bipartisan legislation, although I must say that this side of the Capitol has not done much with it. But we're doing our part in the House and hope that we can influence some movement here. I think that when we find that the leader will send the pieces of legislation out to the particular committees, that we'll see some results. But we do have a very able staff that really know the persons and know how to research the persons within the field, the expertise, to make sure that we get the proper information. This is not a subject that's going to go away anytime soon. As a matter of fact, we're just beginning to see the impact and the attention that we need to give to the area. I really don't know how interested or how involved any of you will be, since I don't know that much about the group and I didn't see a brochure. But I can say that I hope you can be ambassadors to help spread the word that this is probably the most serious crisis that we're going to be facing in the next years to come, because we have spent a lot of time denying, not addressing, and it's not just been the United States, it's been globally. But I think now we look like we're the ones dragging behind with the approaches of which we've taken recently. It's not about protecting, really, a particular industry. It's really about the health and welfare of human beings. And I think that many of the fossil fuel companies are beginning to acknowledge and recognize that. We've had a visit up to the ExxonMobil Research Lab on Environment, and as much as it's not publicized, I don't believe that we have too many, not here on the Hill, that are not aware of what kind of crisis that we're really involved in, and what kind of crisis we will continue to be involved in for a long time to come. Our populations continue to increase. We see movements of people around the world from one place to another, and many times that has to do with the climate, food supply, health care availability, and we'll continue to see that. It'll become our responsibility to see what we can do to approach it so that eventually we will have some answers. It's not so much of a mystery of what we need to do. The question is, do we have the courage to do it? And do we have the backup, people that are working in the fields every day to have the courage to talk about it and spread the information to make sure that we are not neglecting what we can do. And so I wish you well and hope that you will continue to be a mouthpiece and an actor, because this is probably the most important crisis in the world today. It will not be challenged, it will be challenged, but it will not be corrected overnight, but it will take a consistent attention with consistent resources to make sure that we go in the right direction. We're open as a committee to listen to information coming in. We've tried very hard to make sure that members of the committee that had ideas bring those ideas to the table. We have provided for opportunities to pass legislation looking at all areas of the environment, including plastics, and so we're not attempting to look for opposition nor stir up, but we're also not going to avoid those areas that could be questionable at the expense of human life. And so we continue to move in the direction we think we should be moving in, and we hope you will continue to encourage us and bring in information, ask any questions, because this is too important for any of us to decide that somebody else is going to do it. We must be in it ourselves. And so thank you for your input. Thank you for whatever you're doing in that direction today, and we hope to hear from you. If you have any questions, I'll try to answer them.
Sure, if there are some questions for the Congresswoman, we'll be happy to take those at this time.
Here's one right over here.
Yes, I'm just wondering what's the status?
There's some mics I'm going to go around, and please wait for the mic. And if you'd be kind enough to just let us know who you are and where you're from, just quickly, and then...
Yes. Jonathan Patz, University of Wisconsin. I'm just wondering about the bipartisan climate caucus in the House. What's going on with that?
I have no idea.
Oh, sorry.
I hope they're doing good work, but I'm not a member of that bipartisan climate caucus. You know, about 3,000 caucuses, and I just can't get to all of them, but we're doing our work on the committee.
We'll take one more question, and then I know the Congresswoman has a tight schedule.
Thank you, Congresswoman. That was great. My name is Matt Burke. I'm an urgent care doc just across the river in Arlington. I was curious if you could handicap for us, I think it's H.R. 763, which is a cap and dividend bill that's been floating around in the House at the moment.
I'm not sure. Our chief of staff of the committee is here. Are you familiar with that bill number? He asked the question, give the name of the title of the bill again, or the number. We don't usually go too much by numbers here, but...
I think 763. It's a cap and dividend bill.
That's probably in Energy and Commerce.
Committee, probably.
Energy and Commerce are ways we not have jurisdiction.
We deal with all of the research, the actual action of addressing energy in particular is done in the Energy and Commerce Committee. Yes.
Thank you very much.
This lady right
You want to
here.
take Mona's question?
I'm wondering from your perspective, Mona Sarfati from the Medical Society Consortium on Climate and Health, and also George Mason University. From your perspective in the House, I'm wondering what you see as the most important obstacles to moving forward with policy on climate change. And from our perspective, we watch what's happening, and is it money in politics? Is it the industry, the influence of the fossil fuel industry? Is it just the sort of cohesiveness and competitiveness of the Republican Party? What is your perspective on that, on the obstacles?
Well, right now in the House, we don't have too many obstacles because we have a majority. But clearly, there are partisan attitudes. I must say that on our committee, there had been a real partisan divide up until at least the last 6 years up until now. We don't see that as much. We take the time to be inclusive. We've made sure that everyone has a question answered. So some of the people who were the most verbal and vocal objectors the last time are fairly quiet and on the program pretty much right now. Most of all legislation that we brought out of our committee has been bipartisan. And pretty much most of it has passed on the consent calendar because we've taken the time to make sure we have good evidence, good witnesses, and they're allowed to have a witness as well at every panel before we send it forward. And I'm not saying that it has a unanimous consent, but it has that appearance. There are some who are just not saying very much because I think they feel outnumbered. But that is, the House is really not the problem. It is really getting it to the Senate, and I think that what's occupied the Senate is listening to see what's going to happen with the impeachment process. And even though the impeachment process is going on in the House, that's 5 committees out of about 30-some committees, and the other committees are working every day on their agendas and moving legislation. It just doesn't get, the press is not nearly as interested in any other thing but the impeachment. But don't let that impress you that nothing is going on in the House because every committee is working and working hard. I don't know if I could put in much more time than what we're putting in now because we're at it every day. And we have passed some good and effective legislation, but it has not moved as we had desired it to move in the Senate. And I can't read Senator McConnell's mind, but it appears that he's holding as much as he can without sending it to committees or getting any kind of reaction from the committees as he's kind of controlling, looking and watching every minute of the impeachment process in the House. And it's unfortunate, really, that it has taken the entire notice of the actions on the Hill for the impeachment, which that is probably about less than a third of what's going on the Hill. Thank you.
Councilwoman, thank you very, very much. And we appreciate you coming in to be with us so early on Monday morning. It's very kind of you. Next, I'd like to bring to the podium a young man. I guess I get to call him a young man still. He's giving me the high sign. Dr. Vivek Murthy. Dr. Murthy is the 19th Surgeon General of the United States. He was served from 2014 to 2017. At that time, he was the youngest active duty flag officer in federal uniformed services. He's an internist, an entrepreneur who's built many, many programs. And as many of you know, he's been an extraordinary scholar, advocate, and builder of systems. The 19th Surgeon General of the United States, my friend, Dr. Vivek Murthy. How you doing, man? Good to see you.
Well, thank you so much, Georges, for that kind introduction. Georges has been a partner, a friend, and a public health advocate for a very, very long time. And he was actually one of the first people I turned to when I was nominated to be Surgeon General, and later when I was confirmed, as I was thinking about how to address so many of the public health issues that our nation was facing. So thank you, Georges, for that warm introduction, but more importantly, for all your great service to the public health of our country. You know, when I was young, I was actually inspired to go into medicine by my parents. I was probably 7 or 8 when they began a medical practice down in Miami, Florida. And as a shy kid who didn't have a whole lot of confidence in going out and interacting with other kids, I tended to stay at home a lot. And I spent a lot of time in that clinic with my parents. And I was sorting files often, cleaning up, greeting patients as they came and went. And while I didn't understand a lot about the science in the clinic, what I did understand was what was happening on a human level, which is that people were coming in stressed and anxious and worried. And they were leaving feeling a little bit better, knowing that they had a partner in their healing. That desire to be a part of that kind of healing, that's what drove me to go into medicine. That's what got me excited about health in the first place. And when I became Surgeon General, a great privilege that I'm so deeply grateful for and one that I never expected, I had the privilege of working on so many different issues that impacted public health, from food insecurity to natural disaster responses, to floods, hurricanes, and earthquakes, to mental health issues like depression and anxiety, and to vector-borne illnesses like the Zika virus. But what all of these have in common is that they are made worse by climate change. That's something I came to appreciate more and more deeply during my time in office. And that's why in 2016, we issued a federal report highlighting the impact of climate change on health. And what seems to happen is every year, we seem to learn more and more about just how severe the consequences of climate change actually are for our health. Now, the Lancet report that many of you have in front of you, the reason that we're here today, is the latest in a series of reports and a growing body of scientific research that's showing us just how serious a threat climate change is for our health. It's now implicated in air pollution deaths, which have totaled over 64,000 in the year 2016. And it's also implicated in a growing number of deaths and injuries from what can only be termed a marked acceleration in severe weather events. These include hurricanes and floods and heat waves. Hurricanes like Hurricane Andrew, which I lived through in 1992, years and years before we were talking about climate change as a big issue, but an experience which left an indelible impression on me about how severe one single event can be for years and years on the mental health of a community, on the infrastructure of a city, and on the overall well-being of a nation. Now, what's most concerning to me as I think about climate change, and there are many concerns, but most concerning to me is who will bear the brunt of these health impacts. And the brunt of it will be sadly borne by the same people who bear the brunt of so many other health challenges, the vulnerable among us, particularly our children. It's worth recognizing, particularly when it comes to our kids, the great and painful irony that those who contributed the least to carbon emissions are the ones who will suffer the most from its consequences. Now, as a parent, this horrifies me. I've been blessed, along with my wife Alice, Dr. Alice Chen, who's in the back and who you'll hear from later today. We've been blessed with a 3-year-old son, Tejas, and an almost 2-year-old daughter, Shanti. And I feel what so many parents feel, and what so many people who have children they love feel, which is a fierce desire to protect them and to ensure that their future is healthy and safe. But children born today will face unprecedented risks as a result of climate change. And what I know is that as a parent, I can't mitigate all those risks alone for my child. None of us can do that. And sometimes that makes me feel helpless. But what gives me hope are groups like this and moments like this, when we recognize that it is only by coming together that we can protect all of our children and do right by them. Now, the more that we learn about climate change, we learn that it is inextricably linked to our health. I didn't learn much about climate change in medical school. I didn't learn much about it in residency. I didn't talk about it in the clinic room or with my patients or when they were admitted to the hospital. But I now see just how much of what patients are suffering from is increasingly related to the impacts of climate. But as big as climate change is, the issue itself forces us to ask some more fundamental questions. Questions like the following. Do science and reason still matter in our decision-making as a nation? Can the urgency of an issue like climate change cut through so much of the noise and misinformation that have proliferated on our airwaves and in our social media feeds? And in the face of our children's future being at risk, how can we allow politics and inconvenience to be excuses for inaction? We as people, as residents of this country, we determine ultimately the answers to these questions. We may seek to blame it on our leaders. We may seek to blame it on our media. And there's blame to be given and to be received there for sure. But ultimately, we, as voices, as advocates, as voters, we have the power to push the conversation in the direction of action when it comes to climate. And given what we know now about the consequences, it is up to us to stand up as those voices that are sorely needed in our communities. Now, many of you have already done that, which is what makes me so optimistic about the fact that we can address climate. You know, if you consider the fact that consumers are now choosing sustainable products at a higher rate every year, if you consider that companies like Walmart are starting the Gigaton Project and other initiatives to use their massive supplier power to get their suppliers to take action on climate, if you consider that companies like Anheuser-Busch are now generating enough wind power on their wind farm in Oklahoma to power brewing of Budweiser for the entire nation. When you consider examples like this, you start to realize that there is action taking place. We may not read it on the front pages of the paper. It may not be able to get by the impeachment headlines and other issues of the day that seem to occupy all of our focus, but they are real and they are happening. And that is what happens when societies come together to take action in the interests of children and society. But what we're called to do now is to dramatically accelerate this work. And in particular, to my fellow healthcare professionals and scientists who may be in the room today, I want to tell you that even though we may not have learned about climate in our classes during our education, even though it may not be a part of our professional charter to address, that there is no community that is more important than our communities in standing up and speaking out about climate. The fact that it is politicized and inconvenient is not a reason for us not to do so. In fact, it's more of a reason for us to stand up. Because when we recognize a link between climate change and the health of our patients, the people that we committed to serve, there can be no better reason than to stand up and speak out at a time of great confusion about the truth when it comes to climate change. But as important as it is for individuals to lead in their communities, it is also important for us to lead as a nation. You know, we should be committing to achieving net zero emissions as a country instead of increasing emissions as we did in 2018. And we should also be leading in bringing other nations together to accelerate collaboration and progress when it comes to meeting zero emissions goals. You know, as a country, our history tells us that when we lead with our values, that we are capable of creating great change in the world. That's what happened 3/4 of a century ago, when in the wake of World War II, we led the world and brought countries together to rebuild after one of the most difficult periods in our world's history. That is the power of what we can do when we lead as a nation. And so now is the time for our moonshot on climate. And it's time to do that because our children and their future depend on it. I know all of you have seen how dire the predictions are. You've seen that we are nearly at an irreversible point when it comes to addressing climate. But while things are dire, there is still hope. Hope that I find in the stories of those who are taking action already. Hope that I find in the young people in this country and around the world who have stood up in the face of inaction by the generations before them to say that they have had enough of the ignorance and the inaction, and they are now demanding change. That is what gives me hope and what makes me optimistic. Before I remember the federal report came out in 2016, I was approached by a reporter who said, have we seen a historic precedent for this kind of public health threat? And I don't know that we have ever seen a force that affects so many dimensions of health for so many people in recent generations. And that's why, as daunting as these effects are of climate change, I believe that we can address climate change and safeguard our health, and that we have an obligation to do so. But it will take people like each of us and our neighbors and our community members standing together, supporting each other, and doing our part. Because that is how, as a nation, we have succeeded in the past. We've overcome great challenges we faced in the past because we have held on to a deeply American value, that we are fundamentally responsible for each other. This is not a nation built entirely on self-interest. This is not a nation built by the Lone Ranger who goes out and builds a company or builds a town. All of those stories of individual achievement often have other people behind them. Our story, America's story, is a story of collective action. And that's what we're called to take right now. My grandfather, he understood this value more than half a century ago in a small village in India. He was very poor. He had 6 children, including my father. His wife, my grandmother, died from tuberculosis when my father was just 10 years old. And in the midst of bracing poverty, he had to just figure out how to make things work. They had so little food in the house that my father would tell me each night they would boil some grain, some dal, and they would dilute it with more and more water so that they had enough to fill each bowl around the table. They were so poor that my father didn't have anything to wear in terms of slippers or shoes until he was 15 or 16 years old. The first time he wore a pair of slippers, it gave him blisters because he was just not used to it. That's how poor they were. Yet, despite not having enough food, my grandfather made it a point to take a month every year where he traveled from village to village, raising money for a youth hostel in the village so that other kids could study. Now, other people would look at him and say, this is so irresponsible. Your own family can't eat. And yet here you are raising money for other people's children. Have you forgot where your responsibilities are? And he would just listen patiently. And at the end, he would say, those children are our children too. Those people, they're our people too. And when I think about the children that my grandfather was serving, when I think about my own dear children, when I think about all of our children together, I wonder what we're going to tell them about what we did at this defining moment in history. Well, I want us to be able to tell them that at a time of great need and in the face of great obstacles, that ours was a generation that stepped up to meet that challenge, a generation not defined by age, but by spirit and a commitment to making this world better. I also want to tell them that when we stepped up, we moved not only our country, but the world to address one of the greatest threats of our time. And I want to know that we succeeded in preserving and passing on the greatest legacy that we could to future generations, a planet worthy of our children. To all of you who are gathered here today, people who have dedicated yourselves to climate change, who have taken time away from your families and from your workplaces to be here because you believed in the urgency and importance of addressing climate change, I want to say a heartfelt thank you. Because change starts through conversations like this, through groups like this, through gatherings like this. And I believe that the world does in fact get better when people choose to make it so. And so my thanks to you for being those people. Thank you very much.
Thank you very much, Dr. Murthy. I'd like to bring up to the stage 2 folks, Dr. Jeremy Hess and Dr. Renee Selez. Some of you know, Jeremy is the author of the 2019 Lancet Global Report, and also a senior author for the 2018 and 2019 U.S. Policy Brief. And Renee, of course, is the lead author on the 2018 and 2019 Lancet Countdown Policy Briefs. They're both emergency physicians. Jeremy is also involved in environmental and occupational health. And as another ER doc, I'm just excited to have them both here. Thank you.
Thank you very much for the kind introduction, Dr. Benjamin, and thank you to all of you for being here this morning. I'm humbled and gratified to be in the presence of so many great health professionals, Nurse and Congresswoman Johnson, Dr. Benjamin, Dr. Murthy. The commitments that you all have made and your service are remarkable, and we're very gratified that you came and spoke on behalf of the Countdown launch today. You should have in front of you the 2019 report of the Lancet Countdown on health and climate change. The Lancet is one of the world's most influential medical journals, and it has a very strong commitment to evidence and also to public health. And the Lancet came out with its interest and focus on climate change about 30 years ago, and has been publishing Countdown reports since 2015. And from the beginning, 30 years prior, the themes of both the impacts and the opportunities in this space have been clear. And that trade-off has resonated for the last 5 years of Countdown reports. This year's report takes a life cycle perspective. And this is in recognition of the fact that we've entered an era where our decisions of the last several decades and prior are now impacting the health of children the world over. And this year's report, which has 3 key messages, highlights those impacts and the remaining opportunities for children the world over. The first key message of this report is that climate change will affect the life of every child born today. Without dramatic action, climate change will define health at every stage of their lives. The message to today's generations of this report is that we're leaving a legacy with the decisions we're making today. And you can see in the report in front of you that we're seeing hazardous exposures increase the world over. We can continue to accumulate global data related to exposures, like increasing population exposure to extreme heat, increasing exposure to wildfires and wildfire smoke, and pervasive, persistent declines in all staple crop yields around the world in the last several years. The health sector has noted this and has begun to respond. And as you'll see in the report, there was a survey of UN member countries. Approximately half of them have addressed health and climate change in their assessments of climate change impacts in their countries. However, only a quarter of the world's countries have actually translated that evidence into action by funding commitments related to climate change and health. The second key message of the Global Report is that there is, for now, another path. One that would keep temperatures below 2 degrees Celsius. And this path will transform the health of children born today for the better. And you can see glimpses of this path in the report. We can see many opportunities. It's a bit of a glass half full, glass half empty moment. And whichever motivates you more, I encourage you to take that perspective. What we can see in the report is that there are persistent drops in emissions in many regions of the world, including the U.S. and Europe and China, but it's halting. Year on year, there are some places like the U.S., as Dr. Murthy said, where that trend may be starting to reverse. And there are many other places where the trend persistently is upward. We see great opportunities to reduce emissions from red meat consumption, which continues to climb the world over. And we see tremendous opportunities for the health sector to reduce its emissions, which for the first time in this report are quantified globally. And of course, the U.S. leads the way in terms of its emissions, but unfortunately not in terms of its emissions reductions. And that leads to the third key message from the report. And that message is that an unprecedented challenge demands unprecedented action. It will take the work of all 7.5 billion people on the planet to ensure that the health of a child born today won't be defined by a changing climate. Health can and should take the lead. And while, as Dr. Benjamin said, we can't doctor our way out of this, we can doctor our way through it. This is what we do. And this Countdown report offers a roadmap, highlights the risks, highlights the opportunities, and outlines how we should talk about this with ourselves and our own professional societies and with our patients and communities. The report sets the global stage, lays out the context for the impacts here in the United States. The impacts here follow the same themes, but the specifics are different. And now I'd like to hand over the podium to Dr. Renee Selez, the lead author on the U.S. National Brief, so she can tell you about that report. Thank you.
Good morning. Thank you, Dr. Hess. We all have those transformative moments in our lives. And one of mine happened about 6 years ago when I watched a presentation on how climate change is harming health. I realized then and there that that was my God-given passion, and I completely redirected the stage of my career to work and focus solely on climate change and health. As an emergency medicine doctor, I'm trained to respond to emergencies, and it has become increasingly clear that climate change is one of the greatest health emergencies facing our country today. So I can't imagine working on anything else. I also believe it's my ethical duty to make the connections between climate change and health, not only for my patients today, but for my patients of tomorrow. The U.S. brief adds to a mountain of evidence that already exists that makes one thing very clear. The faces of climate change are not icebergs or polar bears, but they're the faces of our children, our aging parents, our less fortunate neighbors. And if that isn't enough to motivate you, then your own. A large reason I went into emergency medicine is because I have the privilege of treating the beautiful palette of humanity, whoever walks into the door of my emergency department. So I treat the homeless to professional sport players, and every life has equal value. While climate change threatens the health of everyone, it threatens the health of certain populations more. They disproportionately bear the harms, and often they're the ones who have contributed the least. And that is a key focus of the U.S. brief this year. With every degree of warming, a child today faces a reality of dangers of a warmer world. And climate change and the air pollution that drives climate change threatens this child while still in the womb, and the health impacts only accumulate from there. To quote Dr. Nicholas Watts, the executive director of the Lancet Countdown in the UK, he said, "We have no idea what this looks like from a public health perspective, but we know it's catastrophic." Children are marching in the streets because they recognize that their health, well-being, and quality of life are being robbed. Extreme heat is making it harder for workers, especially those who work outdoors, and we lost 1.1 billion potential labor hours over the past 18 years. And southern states lost between 15 to 20% in July, which was the hottest month in 2018. Older people are increasingly exposed to heat waves, and they're an especially vulnerable population to sickness and even death. For me, this is not just a statistic, because these are patients that have names and stories. So in Boston this summer, I'm an emergency medicine doctor at Massachusetts General Hospital, we faced some record heat. And one patient that I treated was an elderly man whose wife called 911 because he was acting confused. The ambulance crew, who I know well, said that they literally opened the door and were hit by a wave of heat from their apartment. It was on the top floor of a very old building. They had no air conditioning, and all of the windows were closed except one. This man's internal core temperature was 106 degrees Fahrenheit. So the reason he was confused was because his brain was broiling, and that's the exact definition of heat stroke. Now, our team rallied and cooled this man, and he survived. But I think this highlights that of all of the extreme weather that we face, heat waves are the most life-threatening and kill the most in the U.S. But it often doesn't make the headlines like some of the other extreme weather events can. And that's because people die quietly in their homes, on sport fields at high schools, or on the job, like the man in the military that we highlight in our case study. Meanwhile, air pollution, like that formed from the burning of coal, killed over 64,000 people in the US in 2016. And some of the latest research that we highlight shows that Blacks and Latinx suffer exposure to air pollution disproportionately and to a greater degree than what they contributed through their own consumption of goods and services. So these minority groups are suffering harms more. But acting on climate change is a prescription for health, moving us towards a just world where everyone has the opportunity to the healthiest life possible. Now, nothing is harder for me as a doctor than a patient in front of me for which I don't have treatments to either relieve their suffering or save their life. Thankfully for climate change, we have the treatments, solutions to shift away from carbon pollution and towards clean energy, and working to find a way to not only improve the health of ourselves, but our neighbors. All we need is political will. We highlight in the brief that in 2016, the most recent data that we have available, our energy sector had the lowest carbon intensity ever recorded. Renewables are being used more frequently, and they are becoming increasingly price competitive. However, in 2018, our carbon emissions in the energy sector rose by nearly 3%, the largest gain since 2010. And overall, our carbon emissions in the United States remain one of the highest in the world. We use approximately 15 tons of carbon per person here in the US, versus 7 in China, 5 in the UK, and 2 in India. So we have significant work to do. We include energy data in this brief because we want to stress that this is a key root cause that we must address to improve health. And we must urgently and boldly reduce our carbon emissions and decarbonize, while finding ways to also improve health, like through promoting transportation that increases physical activity while also reducing greenhouse gas emissions and air pollution. Meanwhile, cities are working to improve the health of their residents. We show that 2/3 of US cities that were surveyed have already done climate risk assessments or were in the process of doing so. This is critically important because different regions of the US are hit by different geographic pathways for the harms of climate change. We highlight a study in 2019 that shows that the peak in hospitalizations due to heat injury was 80 degrees Fahrenheit in the West and Northwest and 105 degrees Fahrenheit in the South. So this shows while certain solutions are universal, they have to be tailored to the local environment. There's a quote from the 2018 Global Report that really drives my own research, and that's that climate change has the potential to disrupt core public health infrastructure and overwhelm health services. We have to ensure that our health systems are in fact still standing with health professionals and supplies ready to care for our communities when they're most in need. And the medical community is increasingly recognizing this fact and unifying together and amplifying this message. because we are increasingly seeing that the need and opportunity that climate action shows and proves to be for increasing health is very clear. But when a patient is in front of me is critically ill and crashing, I give them every treatment that may save that patient's life. I don't hold back. And the same is true for this emergency. We need to implement all of these potential solutions together at once for this health emergency. Now, critically ill patients, they also tend to have a very narrow window where certain treatments work. If we don't act quickly, the same treatment we give a patient that may have saved their life if given earlier may not save their life if given too late. We are in that narrow window right now for the climate crisis. The climate scientists have clearly outlined that those of us alive today have the profound responsibility to implement the bold and sweeping action that is needed to reduce our emissions over the next decade. And we are joining together as a global community, as there are numerous other launches that are occurring today around the globe, not only here in DC, but in the UK, Malaysia, Canada, Chile, the UAE, and Brazil. And we're all having the same conversation because the evidence is clear. Yet the way in which patients are saved is not through one provider, but through teams. And thus my optimism comes from all of you, the faces of those of you that I've gotten to know over the past year and a half working on this project, and those I have yet to know but look forward to meeting. My optimism comes from your unique expertise, from your disciplines, and your unique perspective. Improving health is a common ground that we can all agree on and stand together for. We have the treatments, expertise, ingenuity, and increasingly we're gaining the willpower to solve climate change. Momentum is rising. The day has come to act decisively together. Thank you.
So I think we have a little bit of time just for a couple quick questions. Let me just ask you both, what, we've got this report and we've got the brief. What can we do to, as an individual, these folks when they leave this room, what can they do as individuals to really help move the ball and connect the dots?
Thank you, Dr. Benjamin. Well, as individuals, you're powerful, and you can take the information in the Global Report and in the National Brief, and you can use it to start conversations. You can start conversations with your friends and your family and your colleagues at work. You can start conversations with your facility manager in your hospital. You can start conversations with your department chairs. You can start conversations with your congresspeople and your senators. And you can take the policy recommendations here as openers and see where the conversation goes. But throughout, I encourage you to highlight the urgency and the impact on future generations. Thank you.
The one thing I'll add is that there's evidence that shows that even climate skeptics, they may not listen to the World Health Organization or climate scientists or the UN, but they'll listen to their primary care doctor. And in fact, nurses are perhaps even have been shown to even be more trusted by the public. So we have a very profound responsibility and opportunity to deliver this message because people will listen, and it is our ethical duty, in my opinion, as healthcare providers.
Let me ask another. So not everyone here practices clinical medicine or runs a health system, but probably everyone here is either a patient or has someone in their family as a patient. What can we do from the grassroots as patients or people who care about our family members who may be patients to encourage our clinicians, the health leaderships, and the health systems in which we receive our care to address this issue?
I think we can persistently, consistently frame climate change as a health issue. That climate action is about health protection, that reducing emissions, whether they're from fossil fuel combustion or red meat consumption, whether they're from passive single occupancy vehicle travel, whatever they're from, that changes in all of those sectors are good for health. They're good for our own health, they're good for the health of the people that we care for, and they're good for patients everywhere. So recognizing that climate action is health protection, and increasingly that climate change is impacting all of these different spheres of people's health. And so climate action is also health protection against the future ravages of climate change on individual patients.
Okay.
What I'll add is that we know that even if I were able to snap my fingers today and somehow stop all greenhouse gas emissions, and we could all go home and work on some other critical issue, that we still are en route to suffer health harms. And so we have to learn how to protect ourselves and each other. And so I think a key thing is to talk to your doctor, talk to others about how you and your family are being harmed by climate change, because that makes it a health issue. It makes it real, and it makes it personal. And there are things that we can do, and the medical community is rising up to do this, to help clinicians and other healthcare providers to be able to better equip patients and protect their health. But the second thing I'd say, and perhaps I would say even more importantly, is, as I said in my remarks, is that what we lack is political will. So we have to talk to your local, state, and federal representatives. We have to have our voices rise up in unison and say that we are no longer going to accept these health harms that are being perpetuated against our children and the vulnerable, and including ourselves, even if right now we are somewhat, protected. And that is the way that I think we can move forward, because the solutions and the treatment are here. We just have to have the willpower to implement them.
Thank you. So let me take a couple from the audience. The gentleman right back here. We can get a mic to him.
Thank you so much. I'm the Reverend Mitch Hess from the Evangelical Environmental Network. We have been talking healthcare since I've been president. But the one thing that we need your help on is getting those local family practitioners and nurses to be engaged. All around the country, I try to talk to physicians, to get them to go and visit their congressmen, to talk to their patients. And they have yet to do that by and large. And I know in fact, I just spent 3 days writing a health brochure for Pennsylvania on the effects of natural gas on children's health and climate. And not one physician would help me put it together. We need the political will of not just medical associations, but you folks to be leaders in this medical community to help us to get that grass movement started so we can do the action. That's my request. Thank you.
Thank you. Let me play my matchmaker role. Mona Harrison right here. Mona, would you please stand up? Mona, yeah. And introduce yourself and what you do and the network that you have put together.
Sure. So I'm Mona Sarfati, and I direct the Medical Society Consortium on Climate and Health, which is 25 medical societies and 35 affiliated public health groups. And on our advisory committee is Bob Inglis, who's a former member of Congress from South Carolina and very much a part of the evangelical community. And so I would very much like to speak to you about how we could try to get these two things together.
I'm a very personal friend, and number two is I use your opening statement all the time that the people from James Madison put together. So I'm very equipped with it, but I'd love to work with you on that.
Great.
Mona, sorry I butchered your last name. I've done that before, and I have. So
That's
sorry.
okay.
Okay. And she's put together an amazing physician consortium, which includes a range of medical societies to try to address climate change and health. There was someone else back over here that had raised their hand.
Lepperman from the World Resources Institute. Very good dialogue that you all presented today. I resonate with and agree with a lot of the statements that you made in regards to the connection between health and climate. the gentleman back here talked about something that's very salient and is present globally, not only here in the States, the fact that there is a lack of political will to actually bring this issue to the forefront. It would be really good to get your insights on some tangible things that can be done. I know that health departments have moved forward to try to do these health impact assessments on what climate change is going to do for their respective populations, but where are they going to get the money to do the implementation? Who's going to pay? Can you speak a little bit about that?
Maybe I can. You know, we're working very hard to continue to increase the funding through the federal level, primarily through the Center for Disease Control and Prevention, but in addition, trying to get more state and local governments to invest in the core public health activities that are there to try to support that. So I would encourage everyone to support the consortium of APHA, ASTO, NACCHO, Trust for America's Health, who are really pushing very hard to increase the funding, both at the federal level and the local level to do that. And of course, where there are local coalitions, particularly those that are multi-sectorial, multidisciplinary groups that are trying to improve that funding, recognizing that we have to deal both for adaptation and mitigation, as well as training people on how to deal with these things is going to be very important over the years. With that, yes, please, Jeremy.
So I'd like to make a couple points. The first is in the Global Report, the world's progress toward carbon pricing is outlined, and it's slow, but it's there. And what's clear from the global statistics are that there's substantial revenue flowing from carbon pricing where these schemes have been implemented, and a lot of that revenue flows into both adaptation and additional mitigation and into the health sector. And so that's a clear source of revenue globally. We see some examples of that in the United States. You see it in California, for instance, where they've done a nice job of taking funding from carbon pricing and returning that back to individuals and to the health sector, and the public health sector specifically, which has done a lot of really great risk assessment and preparedness work. In my state, Washington, we've been frustrated by the difficulty of moving this forward. And one theme that's pretty clear is that these carbon pricing schemes need to be very explicit about returning funds back to those who are impacted and are living on the edge. And one additional tax to them is a very unwelcome measure. And so there has to be really very clear pathways for that money to go back to people who are already feeling very stressed financially, and very clear, it has to be very clear that that money is going back to improve their health. But it's possible, and we've seen it the world over and here in the U.S.
I would just like to add two things. So one, you have to make people realize that they can do something about it, and then it's personal. So for doctors, we have to show that it's impacting clinical practice and that there's something they can do to change their clinical practice to actually improve the health of their patients. And I think the same is for cities. And I know there are cities that are working to do this, to show that evidence can lead to evidence-based adaptation. And we can get a few wins that show that we can use the ingenuity and knowledge that we have to better protect health. And then once you get a few wins, then, one, the lessons learned there can be rolled out to other cities, but it also shows that we can do this. And I can't imagine funders, right? They always love seeing wins, so we need to get a few of those wins. And the second thing is for all of you, I'm sure you have wide, potential funding networks, is to talk to them about these issues and show that this money will have huge impacts on improving health. Because again, while we can snap our fingers and stop greenhouse gas emissions, we still have to protect the vulnerable.
Why don't you give these two a great round of applause. Thank you very much. Okay. You're going to come up and... All right. Thank you.
All right, good morning, everyone. My My voice is back, and I hope it hangs out for the next 5 minutes, which is what Renee has told me I have this morning. So my name is Melissa Lott, and I'm one of the authors on this Global Lancet report. I am not alone, as you already know. Some of my colleagues are in here. If you could just raise your hand for a moment. I know there's at least 2 in the front. So we have a number of different authors here. 4 different authors here, and if you look at the group of authors on this global report, it is what we were just talking about, an interdisciplinary group of people. I am a doctor, but I am not a medical doctor. If there's an emergency, I'm glad there are others here today. But what I focus on is looking at these levers, what we can do to the questions that are being asked to change the trajectory of something that is quite honestly scary and depressing when I look at it. But then when I pause and I look at the potential solutions and the things that are economic today and that we can implement today, I feel much better about it all. So I'm an author of this report. I'm also a senior research scholar at something called the Center on Global Energy Policy at Columbia University. And if you look at the core theme of that center and why Jason Bordoff, when he left DC, went up there and started the center, it's to bridge a gap between academic conversations, where we track a lot of numbers and talk a lot about things, and policy, where they want good information. They want to know how to devise the most effective policy they can to reach their targets and solutions, and they can't get the information on the timelines that they need it. So when I look at this book, I see opportunities. And at the heart of that is the energy sector, and that's the sector that I work in. The energy sector is not just responsible for 2/3 of global greenhouse gas emissions, it's responsible for the vast majority of key air pollutants that make us sick today. Before I joined Columbia University, I was based in Asia and in Europe, working for organizations like the Asia Pacific Energy Research Center in Tokyo and the International Energy Agency in Paris, who recently released a report looking at different development pathways for our energy sector. And in there, it's very clear. We are not on track to make the reductions that we need to, but if we do change the track that we're on, this is to key message 2 of the global report, we have the opportunity to massively improve public health, not just abroad in these other countries that I've worked in for the past 7 years, but here in the United States. In my city of New York, my new home, thousands of children go to the ER every year with asthma attacks that are directly attributed to unhealthy air. And when we track where that air comes from, it's the energy system. So whether you care about air pollution in children and asthma, or whether you care about climate change, whether you care about sustainable energy sources and affordable energy, the reality is you care about the energy sector and where it's going, because it affects all of our health, it affects all of our bills, it affects every single one of our days every day. And if you're a bit selfish like me, and you love turning on the lights and having them come on, and you love using your iPhone, my pocket computer is always with me, then you want the energy sector to keep going, to be strong and resilient and bold. So there's some good things happening in this report that I was asked to highlight, and also some not so great things that we have opportunities in. When we look at the good, we see that 45% of global growth in power plant capacity, so produce this electricity that keeps these lights on, came from renewables. That's fantastic. About 1/3 of our electricity globally now comes from renewables. But the energy intensity of our energy sector globally has remained constant since about 1990. And since we keep using more of it, that means that our emissions are going up. And within that, we can focus on how our energy use keeps going up, but the reality is that we have 3 billion people without access to modern energy and to fuels that will keep them healthy and safe. The data are clear that we have the technologies we need to shift this, to change this right now. This is a massive, tremendous health opportunity. And if we focus on the energy sector, we can rapidly shift ourselves and accelerate ourselves when it comes to reducing greenhouse gas emissions, but we can also reap many, many health benefits. So I'll give one example that Renee and I were speaking about the other day. When I was in Europe, I was asked to look at the UK's Climate Change Act. And there's a report on this that came out in 2016 as a part of the Lancet Countdown process. And they said, okay, so we're looking at the UK Climate Change Act. We're looking at energy technologies. Could you tell us the techno-economically optimized pathway to getting to this carbon reduction? And I said, sure, I could do that. I'm a geeky modeler. You just tell me what pathway you're interested in, and I can plot that out. But what if I did a step more than that? What if we looked at public health? And what if we looked at air pollution directly in that pathway? And it was easy in the UK because we do have a national healthcare system where we directly pay pay for those health impacts. So we pay for the lung cancer, we pay for the asthma, we pay for when there's a heat wave and people are fainting in their homes and having these problems where their entire bodies and core temperatures and things that I don't study, but all those things are getting to the point where I can imagine, man, there's no way you can think consciously at 106 degrees Fahrenheit. And they pay for those things, so I can put an economic impact on it. And what we found when you boil it all down and you do this pathway is that if you look at health and you look at the immediate health impacts around air pollution, you actually accelerate your progress towards reaching your climate goals by about a decade. So you have another decade to figure out all the gaps in political will. And a decade might not seem like much, but when we look at the emergency that we're faced with and what the data are clearly showing us about the health effects that are already happening, that decade is exciting. And that decade is an opportunity to make sure that our children and ourselves are avoiding some of these really terrible health impacts, or at least minimizing the impact. So before I introduce the panelists and bring them up one at a time, I wanted to speak to the process behind the Lancet Countdown. I'll date myself in the process by saying I was part of the countdown before there was a countdown. I was part of the countdown when we called for a countdown. So when we look back at 2014 when I joined and we were saying, we know this is an emergency and we know that more than that, it's a tremendous opportunity that if we don't capitalize on part of that, what are we doing? What are we missing? What could we have done? And we really don't want to be asking ourselves that in a few decades. So we said we need a countdown. And when I joined in 2015, we said, what are we going to track? And as a member of Working Group 3, we started going through the evidence and combing through the data. As an engineer, I always go back to the data. And we said, the energy sector is what we need to focus on. And now I speak with doctors and physicians, and they're asking me about coal plants. And they're asking me about cars going down the roads. In this process of the Lancet Countdown, we have plotted out where hospitals and primary schools and secondary schools are located in different countries and what the air quality is like there. We found that in London, actually the top lung cancer treatment center in the city was in a pocket of extremely disturbing air quality. The doctors in that system said, I'm treating these patients in the middle of a place that's making this sicker. I can do something about that. Now in London, we have the ultra-low emission zone. And there were many other factors that came into that, but that was part of it. When I was at the United Nations about a month ago, there was a physician there who was talking about 30 years ago, what his patients look like. 30 years ago, 90% of his patients were smokers, most of them were men. Today, more than half are non-smokers, and most are women. So he's leaving the surgical floor and actually doing something about that, and this is very inspiring to me. I'm very excited to be inspired by the panelists I'm about to introduce here in a minute. First, I'm going to ask Maya Earls to come up. She's a reporting fellow for Climate Wire, where she covers critical issues pertaining to climate change and will serve as the moderator for our session today. Is Maya in the room? Paige, there we go. We could welcome her up. Next, I'm going to welcome Dr. Adrienne Hollis, who's a senior climate justice and health scientist at the Union of Concerned Scientists. I saw her right there, where she focuses on health aspects of climate change. If I could next welcome Daphne up. Daphne Frias is a youth climate change activist, a pre-medical and public health student, and also serves in the North American Regional Focal Point for SDG 16 at the United Nations Major Group for Youth and Children. And on a personal note, I'm very excited to hear that they're going to be using this report in one of her classes this term. So we can welcome Daphne up. Next, I'm going to welcome Dr. Nasima Rao, who's an assistant professor of energy systems at the Yale School of Forestry and Environmental Studies, who was recently featured in the New York Times article showing that reducing inequality could improve our ability to mitigate some of the worst effects of climate change, and who has a paper coming out today in Nature Energy talking about energy and its use to eradicate poverty. And finally, where is Dr. Samantha Ahut? There you are. If you could come on up. She's a practicing pediatrician in Virginia and a fellow of the American Academy of Pediatrics with a special focus on climate change and pediatric health. And with that, I will hand things over to Maya to talk us through a very good discussion. Thank you very much.
Hello, everyone. Well, it's great to see you all today. So this year has been a big year when it comes to climate change. There's been the rise of Greta's influence. We've seen a youth voice activated, and we've also seen an increasing number of reports, including the Lancet Countdown, on how climate change will influence public health. So with that, I'd like to discuss with everyone here what all this means and where do we go from here. So to start with, I'd like to ask the panel of everyone here, if we can snap our fingers, if we can open our eyes tomorrow and see policies in place that will address climate change, what are the 3 policies that you all want to see? I guess we can start from here with Daphne.
Hi, everyone. Firstly, I just wanted to start by saying it's been pretty interesting to hear everyone mention the young people and to be here representing a whole entire generation of change makers who are really going out there and doing something about the current crisis that we're in. So in terms of legislation, I feel like that's a very buzzworthy word, but a lot of people don't know what that looks like in terms of actually solving climate change. And I think for me, where I come from, I live in West Harlem in New York City. I live in a community of predominantly Hispanic and African American individuals. And for them, climate change isn't a thing that they don't have to wake up and think about. It's at the forefront of every thought they have every single day of their lives. So I think about when we're trying to propose legislation, be more human in creating that legislation. Remember the people who are actually at the front lines of this crisis. When we talk about the Green New Deal, it's pretty interesting about half of the Americans out there who are talking about it don't really know what the Green New Deal is compromised of. And I think it's really scary because, you know, as Greta, as a bunch of my friends out there, as I have said, we don't have any time left. And I think when creating legislation, we must think about, is it accessible to every single person who is facing this crisis? When we talk about passing the Green New Deal, yes, there are so many things in it that can sort of stop the deadly timeline that we're on. But at the end of the day, are the labor workers who are going out there in unbearable temperatures, are healthcare fields really being properly utilized and properly listened to in terms of creating legislation? I don't think that's necessarily the case. And I think especially one of my call to actions here is when we're thinking about science, the way that science works is through investigation and by asking questions. And I think we must ask ourselves, are we asking the right questions when it comes to solving the climate crisis? And I unfortunately think that we're not. So I urge all of you to think about what those questions might be.
Good morning, everyone. Good morning, everyone. The major challenge that environmental advocates, particularly environmental justice advocates, face is proving causation and making the connection between exposure and health effects. And now, as we read in the brief, there is the additional challenge of climate change. There has been, it's not new, but it's it exacerbates already existing threats. So any policy that I think one of the main foci, I guess, of a policy team or plan is to incorporate community science, right? Because communities know more than anyone about the health effects they have experienced from exposure, the lives lost, the people who've been treated and thankfully survived such diseases as cancer and others. So any policy effort should incorporate not only community science, but also have community partners at the table. The term that communities use, for us, by us. So it makes sense that communities would need to have an input as equal stakeholders in any policy decisions that are being made.
First, at the outset, let me say thank you very much for having me. It's an honor to be here. I'm not a healthcare professional. I'm someone who studies energy systems. And what I do know a little bit about is thinking about what it will take for us to transition to a low-carbon society. And so thinking about the different ways in which energy systems need to be transformed, but also their relationship to well-being. And I think the Lancet report has to be commended for adding some new quantitative indicators that are very important to develop our arsenal of well-being indicators. And what you've heard time and again, I will repeat that the science shows that climate change really is a multiplier of existing inequalities. And in order to achieve our most ambitious goals, we really have to address those inequalities. So before I have some very concrete recommendations and policies, I want to emphasize that today in the United States, we have an energy insecurity problem. That is, a fifth of Americans today have at some point diverted money from their basic necessities in order to pay their utility bills. And in some communities in the US, such as blacks in the mid-Atlantic, that's 50% of households. So we have to see this as a backdrop because this energy insecurity is going to make it that much more difficult to deal with future heat stress because you need to cool and people can't afford even today to meet their energy demands. So with that, I do see an opportunity to kill 3 birds with 1 stone. One of them is to redress these inequalities, address energy insecurity, to build resilience to future climate change impacts, and also to protect low-income communities from the effects of a transition to a low-carbon future. That is from the income shocks of an energy transition. And one of those key examples I see is in drastically improving our building stock, and particularly public housing. And there has been talk, of 1 million homes in the US that could use significant upgrades. And by doing that, we can reduce energy demand, we can provide people the ability to cool their homes in order to avoid heat stress, and also reduce emissions. And related to that, I think an important contribution is for us to build a healthy electric grid to support a healthy society. Because as you can imagine, with more heat stress, we're going to stress the grid significantly because cooling comes from electricity for the most part. And in order to do that, technology does have a role here. I think we need to build smart grids, smart consumers, smart homes, and most importantly, make them affordable to everybody. Because this use of technology can allow people to make informed choices as to when they consume energy that will reduce overall energy demand. And we really have to think not just about how do we decarbonize energy supply, but how we want to reduce energy demand. And so there's a role for technology, but it has to be made affordable. And there are other such solutions, but I'll stop for now.
Hello, I'm Samantha Adut, and I'm also delighted to be here today on behalf of the American Academy of Pediatrics. And to the comments that have been stated already, I'd want to add that over the past couple of years, we've seen the marked vulnerability of the health sector to climate change and to extreme weather events, and that I would hope that a comprehensive climate policy would address the resilience of our healthcare institutions. Just as an example, prior to Hurricane Maria, half of all small volume normal saline bags were made in Puerto Rico. The 3 factories making those bags were wiped out by the hurricane, creating a global shortage of saline bags, of small volume saline bags. This caused hospitals to have to convert to new concentrations of medications, to convert to pill forms of medications, to create entire new oral hydration protocols. Similarly, after Hurricane Sandy, they had to evacuate an entire Bellevue hospital. It never had occurred before in the history of the hospital. Recently in California, due to the tragic fires, hospitals have had to be evacuated. So I think addressing the vulnerability of our healthcare system so that we can continue to provide care to our patients and communities is a critical component to addressing climate change.
Thank you. So my next question is basically one thing that has come up recently is that, and polling has shown that general public is aware that climate change is happening, and we're seeing it right now, the physical effects with flooding in Venice, with wildfires and things like that. But there's still a disconnect between how climate change is affecting your health. How is it affecting you personally, your children, future generations, your neighbors? And that disconnect is also happening maybe within health professionals. As a doctor, you understand climate change, but how does it affect your day-to-day practices? So I'd like to ask the panel, both from a health perspective and from a public awareness perspective, how do we bridge the gap between this awareness of climate change and how it is affecting people? I'd like to start with Samantha, please.
Okay. Well, I'd like to say that as a pediatrician, I'm already seeing the effects of climate change in my office. And it's really important for me to convey to my patients the links between climate change and the health conditions they're presenting to me with. For example, I care for two siblings who I'll call Cameron and Deborah. They're 9 and 14, and they are from Panama City, Florida. In October of last year, they learned that a hurricane was going to be coming to the Florida Panhandle. Their mother is disabled and is confined to a wheelchair. They have no car. They are of limited means and live in a modest home. So they decided to wait out the hurricane, and they listened to the radio all night to get updates. And at about 2 in the morning, they learned that it was going to be the first Category 5 hurricane to hit the Florida Panhandle. So at 2 in the morning, with the water entering their home and the winds raging outside, they called EMS, who came and picked them up and evacuated them and brought them to a shelter where they sat through the hurricane of winds 165 miles an hour. So Panama City was basically destroyed. Their home, their school, their doctor's offices, they're still struggling to recover in that region. And so they moved to Virginia to live with their aunt. And they came with basically nothing, basically no material goods, no vaccination records, no health records, because they'd been destroyed in their doctor's office, which had been destroyed by the hurricane. So for me, I've been working with them now to help them rebuild their lives. And this hurricane was really, this report struck home for me because it was likely the defining event of their life. And when Dr. Murthy was speaking earlier, I thought that my role for them has really been to be a partner in healing for them as they go through the process of rebuilding their life. And so it's important for me as a pediatrician to convey the links that I'm seeing in my office to my patients and to help them understand how climate solutions are ultimately protecting their health and their welfare.
Yeah, I think we are moving in the direction of people seeing this link between their views of climate change and the health impacts of extreme events. I just want to point to some interesting polls that were conducted by the Yale Center on Climate Change, the polling center, that as of December 2018, almost 80% of Americans were either alarmed, concerned, or cautious about climate change. The rest being either dismissive or disengaged. But that's quite a large percentage now, and it's been growing. Also, interestingly, 85% of Americans experienced some form of extreme event in the past year, and half of those, or 50%, were extreme heat conditions. So people are experiencing extreme events. They seem to be understanding that climate change is important, and I do think that we just have to play the role of information disseminators, as you've heard. Really try and pushing people to see the connections between their behavior and greenhouse gas emissions. I think besides extreme events where it may be a little bit easier to make the connection, food systems is another one, and really trying to understand the greenhouse gas impact of different kinds of foods, the amount of waste we have in the food system. And so, yeah, I just think we're getting there, but just need more information from experts like you all.
Okay, so the most important way to change, begin action is communication. A good example of that, I was in Superstorm Sandy in New Jersey, and I had at that time, my 2-year-old foster daughter with me. And we were in our apartment, nice, sturdy apartment in Newark, outside of Newark. And the next morning after the superstorm hit, everything was flooded. And of course, we were surrounded by water. I opened the door to see if there was electricity, and there was a flyer that I guess fluttered to the floor that said everybody should evacuate. And when I went down to the office to say, why didn't you knock on the door and tell people? They were like, oh, we just stuck it under people's door. So communication is key. Another thing, I always say that people want to know 3 things. What is it? How does it affect me? And what can I do about it? And in order to generate movement, we need to personalize the effects of climate change for people. For example, it's important to some people. I was speaking with Katie Huffling earlier. It's important to me to know that people with if you have high blood pressure and you're on the medications, extreme heat might affect your medication. I can personalize that and think about climate change from that perspective. If I'm a diabetic, that's another concern. If I'm forced to migrate, I need to have a plan in place when it comes to receiving medication. So personalizing information is important. It's important in another way because it'll encourage people to work at their state and local level. One of the things I was excited about in the report was the fact that so many cities had started or had finished and was in the process of completing risk assessments to look at populations that are more susceptible. That's important because those are the ones that you're going to target your communication and outreach to. So that's a big part of any, changing the thought processes for different communities. Different populations.
I think for me, it really stands out 2 different things. One, especially as a young person, talking about the realities of climate anxiety and what does that look like. For me, it's an everyday thing, as has been mentioned here. As someone with a disability, I know that if I was faced with a natural disaster or something that was heavily impacting my environment, I don't have the ability to quickly get up and leave and sort of protect myself from whatever may be coming my way. But also to know or to validate for your patients, for those who are in the healthcare sector, that if they are feeling things related to what's happening in our climate, that they are valid and those feelings that they have are real feelings, and they can do something to address those feelings. And in terms of addressing those feelings, I think it's also about changing people's perspectives and saying that the way that it is right now doesn't have to be the way that it's always going to be. And I think, especially in minority communities like the one that I live in, something that I do every weekend is I host tree planting gatherings where people can come and plant trees, and it's a community gathering, but then we benefit from the fresher air that the trees are going to give us. And I think it's about reminding people that we get stuck in our patterns, we get comfortable with the way things are, but it doesn't have to be that way, and we can take small actions to create that change.
Thank you. And going along with that sentiment, it was talked about before, there have been times in our history where we have, as a group, rallied together to overcome major challenges. And this is the challenge that we are facing now. So I'd like to ask the panel, how can we tap into this can-do spirit, this united spirit? How can we tap into that to get people motivated to take an active stance on climate change? I'd like to start with you, Daphne, please.
Yeah, sure. Well, I mean, I'm going to be a little selfish and say the young people are doing it the best right now. And thank you. And honestly, I think the reason for that is because we're pretty tired. I mean, we inherited a world that's pretty messed up, to put it nicely. And it shouldn't be that way. And I think what amazes me the most about my generation is that wherever we are faced with a no, we use that as a fire to fuel our passions even further, to create change. And we use our ability as citizens to the furthest extent. We write every letter to our congressperson. We go to every rally and say enough is enough. We protest at every possibility that there is to protest. And I think, especially, as we get older and we get settled into our jobs, it becomes less realistic and figure out who our representatives are and write letters to them. But just because you get older doesn't mean that you stop being an activist. And people always ask me, what quantifies young, and like, when do you stop becoming a youth activist? And it's like, well, who says I have to stop? And I think for me, what's so empowering about this generation is that we know that we have the world's ears right now, and we're using that to our biggest advantage. And I think our ability to make the world that's this big feel this big, that we're all in this mission together, I think that that's incredibly important. There's communities across the globe that are facing climate crises at different levels, but to know that there's one key point, and that no matter where we live on this earth, we're going to feel the effects of climate change, brings us together. And it doesn't matter if you've been, in the movement for, since Greta started the movement, or since maybe an hour ago, because you walked outside and you realized, man, this air is pretty hard to breathe. I think we're a pretty inclusive movement, and I think in a lot of, especially in healthcare, there can be a lot of gatekeeping of knowledge and gatekeeping of resources, and our abilities to really connect with communities that are facing this crisis. And I think something that we could really learn from my generation is that gatekeeping is not going to solve any problems, and we really have to come together as an entire earth that's facing this crisis to do something about it.
So I'm going to piggyback on what Daphne said, because in the environmental justice community, the situation has been that they have not garnered the attention when it comes to environmental issues of those in a position to provide assistance. So we, and I say we because I'm an environmental justice advocate, recognize and appreciate so much that the youth do have the attention of those who can impact policy decisions and just help us to save the planet. And one of the things that I always tout is that we need to engage in partnerships, and mostly non-traditional partnerships, because we can learn a lot from each other, right? We have ideas about things, we have historical knowledge about what not to do, and it's always good to have a fresh new approach to an issue. So yes, environmental justice organizations are so happy that that the youth are inclusive, and we are, for the most part, so grateful that we can sort of take that energy that we feel from the young people, and it helps motivate us to get out and protest, and stand behind the young people as we did with the climate strike, and just be supportive, but at the same time, use that to help get our message out.
Yeah, I think this is a very complex arena, and a lot really to digest and understand for people. I think here in the U.S., we're behind the 8 ball in some ways in terms of the depth of understanding. And I think each of us takes it upon ourselves to be sort of leaders and really try and impart an understanding of not only the impacts of climate change, but how the system is working in order to perpetuate things the way they are. It's really important. I think that can motivate people a lot. I just, from my personal experience, just share an anecdote. I lived in Austria for several years before coming back here, and I met with families who had no idea what climate change was or anything about it. And just by speaking to them and making them aware of what it was, every time they met me, they were concerned about telling me that they actually thought about what kind of car they should buy, or what kind of, what kind of food they should eat, and asked me questions. Okay, is it okay if I eat chicken instead of beef? And so I was amazed that through your own networks, it's really important to be a role model. But there are several people who are playing leadership roles in communities and community organizations who can really do a lot, I think, to further motivate people.
So in the health community, I think one of the first steps is educating clinicians about how the changing climate is affecting the health of our patients. Generally, this is still not something that's taught to us in training. We don't learn about it in medical school or residency, although I think that's on the verge of changing. So as a practitioner who's working with the Medical Society Consortium and now a state-level group, I think one of my goals and my colleagues' goals is to bring educational events to clinicians so they can understand reports like this and give them the information so they know understand how the changing climate affects the health of our patients. And then step two is, what do they do about it? What clinicians will say, this is such a big problem, what do I do about it? And we have the good fortune of being a fairly significant part of the problem, right? Our health institutions emit about 10% of U.S. greenhouse gas emissions, as this report states. So that does give us the benefit of actually having tangible things that we can work on within our own institutions. So if we can work with our hospital to transition to clean energy sources, that's a whole lot bigger impact than we would have just by working as an individual. So we can have significant impact within healthcare, working with our hospitals and our health systems. So I see that as an important role and something that clinicians can really be a part of solutions for climate change through our own institutions.
Thank you. I'd like to use this time to open up for questions. Do we have any questions from the group? Oh, one right here.
I'm Dr. Melissa Lott from Columbia Center on Global Energy Policy. I want to come back to one of the first comments that was made about what are the right questions and are we asking them? I wonder if we could talk about what the right question is or what the right questions are just a little bit more. And if you could share your thoughts on it. And the rest of y'all as well, if you have thoughts on this topic, what we should be asking.
Yeah, for me, it comes from sort of the infrastructure that's in my community. The fact that there's the largest bus depot in Manhattan, smack dab in the middle of my neighborhood, and there's a huge water treatment plant across the street from where I live. And for so long, I didn't realize that that wasn't okay until I started moving out of my neighborhood and going different places for educational purposes, that I realized how disproportionately placed these pieces of infrastructure were. And I think it's not necessarily about the best crafted question, but it's about a question that invokes a thought process that maybe someone never thought about before. If you ask someone, how's the air in your neighborhood? How are the trees looking? You know, things like that maybe you never stop to think about. And then once you do, you realize, this is not that good. Or where I go to university right on Lake Ontario, and I wasn't there this week because I've been working on climate strike initiatives that are happening at the end of the year, but I heard from my friends who are still on campus that the lake was flooding our school buildings and they had to cancel classes early because they were inhabitable. So I think it's about asking questions that make people want to create change, asking questions that it's more about how are you doing as a person, and then underneath that you begin to realize that so many of the little things that are going wrong are so inextricably linked to climate, because it's in everything that we do. And I think one of the main reasons why I am going to get my master's in public health is because I realize that the key of every single social justice issue that we face is a public health issue. The reason why I fight for climate change, the reason why I fight for gun violence prevention is because if we begin to look at these social justice issues the way that we look at epidemics, we'd be so much closer to ending these things. So it's really about asking the questions that beg us to dig a little deeper as to what's going on in our lives.
So first I'm going to ask Daphne to get out of my head. Stop stealing my answers. So I agree with everything you've said. just to, I guess, elaborate a little bit, for me, the right questions are about their environment, yeah. Because you can't just treat the symptom, right? You have to know what's causing it. And I know that personally. I had a brother who was depressed about whatever he was depressed about, and at one point tried to take his life. And the doctor was like, well, we pumped his system, so we're going to let him go. And I was like, no, holistically, you need to find out what it was that was so bad that he felt like he could no longer be here. And I think that's the same with effects of climate change in the health in the health realm. Was we can't just treat symptoms. I've had people come to me with bags of medications, and the doctor is giving me these medicines for my health effects. I'm like, but what's causing it is the question that we need to be asking. So that's the question: is why do you need this? So.
Yeah, I too echo everything that's said. When there's an oil spill and there's devastation of wildlife and other natural resources, GDP goes up in that year as a result of the activities associated with cleaning up an oil spill. It's interesting. I think we have to think about the indicators we use in assessing the progress of society and asking, are they really measuring what we care about? And what kind of society we want to live in? And I think that goes to understanding causes, understanding what's driving, why are we destroying ourselves? It seems weird that we can actually do that, knowing so fully well that this is the problem. So I think that's one thing to ask: is are we using the right indicators, and what kind of society we want to live in? I think in many ways I can picture a low-carbon society where well-being is enhanced in many ways. It's not just a question of reducing the costs of it, but the research is still heading in the direction of being able to quantify that and show it. But I think we need to develop that vision and understand how we can quantify it, how we can present it better.
One of the things I think is important is for the health impacts to be investigated and conveyed to the public on a very local level. And I think that's an important way to help the public understand how the changing climate is affecting their community, their family. And I'm very proud of my state, Virginia, which just this year launched a new climate change committee, their Department of Public Health. So we're just now going to be looking in depth on who are the people that are presenting to the emergency room visit for heat illness. What is their age? What community do they live in? What do they do for a living? North Carolina, which has a CDC grant, has incredible detailed information about that because they've been looking at that so closely. So they know who are the most vulnerable people in North Carolina. What is the temperature when they're going to the hospital? And that information is very real for people, and it really drills down to the local level that people can understand. So I think this report also talks about the increasing suitability for Vibrio infections along the East Coast. The oyster business is a very important business in Virginia. What does this mean? What's happening locally in Virginia oyster farming? How is that affecting the oyster populations now? So this very local information, I think, is critical for conveying the public health implications to people.
I think we have time for one more question. Oh, right here. Yes.
Jeremy Hess, thank you all for your thoughts and your perspective. I'm curious what role you think fossil fuel divestment should play in this fight.
I guess we can start over here.
I'm not really sure. I think I certainly understand that. I don't understand the full power of that, actually. So I'd have to. I think it's very important as a statement, but I don't have a strong enough grasp of how effective it would be as a policy.
I completely believe that is an important step to take, and that's, in fact, an initiative that individuals can take to try and have an impact outside of the democratic system in terms of voting, which is very important, here's a way that you can encourage, for example, universities that we work in. Students, for example, in my department are asking for that. And I think it's a very important mechanism because that is, in fact, a major obstacle if you consider. So it has to be part of a range of different options, of course, such as making sure that we price some of these externalities that we have in society. But yes, absolutely. And I think it's a great solution to present in schools as well, for younger people as well, to motivate them.
I think speaking just globally, I think fossil fuel divestiture is very important. We know the health effects that the fossil fuel industry has sort of caused, if I may be blunt. And I think by investing in these industries, we are sort of supporting the spread of disease and illnesses. Not spreading, we're supporting the existence of disease and industry. It's sort of like by being silent, we agree. So I definitely support divestiture.
I think divestiture is important for two reasons. Primarily, obviously the economical impact, but I think also there is something even more significant that's not always talked about, but the lobbying impact that the fossil fuel industry has. And the more we divest from them, the less power they have because they have less economical holds on our government. In the same facet that the NRA controls our gun lobbying industry, the fossil fuel industry controls our climate industry. And the less power we give them by giving them less of our money, the less ability they have to lobby over our government, which gives us a better opportunity for legislation and change-making pieces of, bills and things of that nature to get passed and to actually be enacted.
Great. Well, thank you all for joining us. Thank you. One more thing.
It wouldn't be right of me and my activist bones to not say this last piece of information. On November 29th and December 6th, we are striking twice. We are striking on Black Friday to send a statement to our government that we are divesting from fossil fuels. We are divesting from capitalism, and we're going out to the streets and saying enough is enough. And then we are striking again on December 6th because, frankly, why not? The louder we can be, the more prominent we can be, the louder our message is heard. And I really encourage every single one of you, this is your lane too. The healthcare field needs to be in this fight. We cannot do this without you, and we need you to help us create change. Think of your kids, your brothers, your sisters, your nieces, your nephews, any young person in your life that you care about. We're asking you to be part of this fight. And something that stuck with me throughout this whole event was something that Dr. Murthy said in the beginning. What will you tell your children? And I'm asking you instead, what will you show your children? Will you come out with us and show us that you care? So please come out. Thank you.
Thank you. That was a great panel. I'm Jonathan Patz. I'm a professor from the University of Wisconsin. I served as co-chair for the first health report for the first U.S. National Assessment report to Congress a long time ago, and I served on the Intergovernmental Panel on Climate Change for 15 years. And Renee and Jeremy asked me to try to summarize everything that you've heard in less than 5 minutes. So I'll just jump in and start Georges Benjamin opened that climate change is here and now, and a reminder that the APHA was about the first to engage in this challenge 25 years ago. Congresswoman Johnson told us that we are in for a ride, a big ride, and that it's the most important threat. Climate change is the most important threat that we face now. She urged that we all become ambassadors, and we need an all-in approach by health professionals. Surgeon General Murthy talked about climate change as a threat multiplier, and this has been echoed in the panel as well. And that those who bear the brunt of climate change impacts are our children, and that those who have contributed least to this problem will suffer the most. He said that ultimately we have the power to raise our voices for action in the interests of children and society. And he said that it's important for us to lead as a country, and when we lead with our values, we can achieve great things. He said that now is the time for our moonshot on climate. And he did say, as Daphne just mentioned, when we look back, we must be able to say and act and show that at a time of great need, our generation stepped up to leave a planet worthy of our children. Now, the co-lead authors on this Lancet Countdown report, U.S. policy brief, Jeremy Hess and Renee Selez, pointed out that we're taking a life cycle perspective, and were three key points. Climate change will affect life of every child born today. There is, the second point, there is a second pathway if we get to a low carbon economy and we stay below 2 degrees centigrade. That would be what we want to strive for. And that finally, that unprecedented challenges demand unprecedented action. And the children that are marching in the streets today, it's because they see their future being robbed. The panel was introduced by Melissa Lott, who pointed out that we are not on track for modernizing our energy, but there are some great positive indicators, like that 45% of electricity globally came from renewables. The panel session went into talking about the good news that youth have the world's ear right now, and that is really giving us some added traction on this issue at a very timely, and is very timely. We heard that climate change really exacerbates the threats that we're grappling with, and that we have opportunities in improving a healthy electricity grid, so that when you turn on your air conditioning to cool buildings, which we need more efficient buildings, when you turn on the air conditioning, hopefully the power source for the AC is from clean energy, so that you don't cause more harm from coal-fired power plant produced energy. And finally, we heard that fossil fuel divestment is indeed an important approach to take. Finally, last two comments, one by Dr. Selez and one by Dr. Lott, that we have solutions. They're here, clean energy. We're not waiting for a miracle to happen. We know what to do. The only thing we lack is political will. And that we have huge health opportunities from clean energy. So I want to just, I'd like to riff on that for a second. And I want to start with a quote. Uh-oh, let me see, I forgot my quote. Hang on. I just lost 14 seconds. Okay. So this is a quote right from the Lancet Countdown. Quote, "The economic gains from the health benefits of meeting the Paris Agreement substantially outweigh the cost of any intervention by a ratio of 1 to 45 or 2 to 45, resulting in trillions of dollars of savings worldwide." In other words, the health savings are worth 20 to 45 times more than the investment cost for clean energy. Incredible. And that, that in this report, there are 9 indicators across energy, food, and transportation sectors. And there are many more studies that have been showing the benefits of reducing fossil fuel burning and how much it benefits our health. But think about the investment costs versus the health benefits. Solar energy has dropped 99% since the 1970s, and it's dropped dramatically just in the last few years as well. And according to the International Renewable Energy Agency, and I'm going to quote, "Most solar and offshore energy projects commissioned next year will produce power at lower prices than the cheapest new coal, oil, or natural gas options, even without any subsidies." A new U.S. study on renewable energy portfolio standards found that for every ton of CO2 emissions avoided, $99 would be yielded in health benefits. And of course, we have even more benefits when you think about designing smart cities that promote active transportation and increase physical fitness, a huge benefit towards reducing chronic diseases. So I'll end by just saying that climate change is here and now, but even if someone doesn't believe the climate science, we can all support clean air for our health and from a low-carbon economy and physically fit children and adults from smart cities designed. So I hope that Renee and Jeremy, that's okay with I did an okay job summarizing. And now my final task is to introduce our final speaker of the day, Dr. Alice Chen. Dr. Chen is an internal medicine physician and served as executive director and founding board member of Doctors for America. Under her leadership, Doctors for America mobilized a movement of thousands of physicians and medical students in all 50 states to bring their patients' experiences to policymakers and move the nation to put patients over politics to ensure that everyone has access to affordable, high-quality health care and the means to lead a healthy life. Fortunately for us, she has long recognized the critical importance of climate change and its threat on health, and is passionate about promoting the optimism of climate action. Dr. Chen.
Well, hello, everybody. It's quite humbling, actually, for me to be your final speaker, given that I'm being introduced by a person that Renee described to me as the father of climate and health. That so many of you in this room participated in putting together this brief and have spent so much time and put so much energy into creating this story about climate and health that we can now bring out into the world. I stand before you as, first and foremost, a mother. When Vivek and I left the house this morning, we kissed our 3-year-old son and our almost 2-year-old daughter on the heads and said, "Go have a good day. Mom and Papa are off to try to make sure the world is better for you when you grow up." And I think about how much I worry about every piece of their lives. Are they eating enough vegetables? Will that little bit of, will those chocolate chips and those pancakes, will it destine them to want sugar throughout their lives? Are they getting enough educational opportunities? Do they have enough playmates so that they'll be social and they'll be able to be successful in school? And I think about all of those little decisions that I think about every day. And then I think about climate change and about the two paths that are before us today. That are laid out in this brief. There's the path of business as usual, where we carry on with what we're doing right now, and their future is much more grim than it should be. And then there's the path where we all come together as an entire planet and hold our carbon emissions down, and we transition to a brand new way of living and a brand new economy where we are in sync with the planet that sustains us. And to me, it's pretty much a no-brainer of which one that my children should have, because they're perfect and wonderful, and they should have everything. I also stand before you as a person who grew up in the San Francisco Bay Area, where my parents and my sister still live. Where last month, when the winds were blowing and dry conditions were everywhere, and their power was switched off, so that the electrical equipment from PG&E would not spark another giant wildfire in their community. This wasn't something that happened when I grew up. I in all my years of proudly saying I'm a Californian and I love California. It's so wonderful. We love the climate and we love our environment. And all of a sudden, I turn on the news and there my state is. It's burning. And I think about my in-laws who live in Miami, where there's a hurricane that's bearing down on Miami, means that my 86-year-old grandmother-in-law has to move, has to evacuate and go to an unfamiliar setting, even though she's very set in her ways and she needs to be in the places that she needs to be. I think it's a little bit dizzying, honestly, to think about the idea that each one of us in this room holds power over our climate. That we're here talking about our ability as the people in this room and beyond to control hurricanes and the level of the ocean and wildfires and all of these unbelievable things that feel like they're out of our control. But amazingly, because of climate change and because of the work that's been done by so many scientists and researchers, we know that it is in our power to control the climate, to protect a child from having an asthma attack, to protect a pregnant woman from having a complication, to protect an older relative from landing in the ER because of a heat wave. Each of us is in this room or tuning into the live stream because we know that we have power. And it all feels very grim sometimes. Everything is changing, and there's so many forces that are against our favor, and we are lacking some of the political will that we need. And yet, why are we all here? Why did each of you get up this morning and show up here in this room to be a part of this? It's because I believe that each of us know that we do have something that we can do. We're not here to hear about the doom and gloom. We're here to reaffirm the fact that we can do something about it. And whether you're a doctor or a nurse or a public health professional, a scientist, whether you work for an association or for an academic center, there is a job for you to do. As people on this planet, we all have a stake in this. It's not just us, it is the people in our lives. And I think all of you in this room can think of the people in your life that this will matter the most to. It's not a theoretical, it's not those millions of people out there, it's the child, it is the older person, it is the vulnerable people in your life. When we think about the data and we think about the projections, it can feel like, who are we to create change? But just think about the fact that this report is being launched all over the world right now. And it's not just the people who are launching this report. Climate change is being talked about in boardrooms across the country, in the biggest corporations in the world. It is being talked about in parliaments and in mayors' offices. There are nations that are deciding that they're going to go with 100% renewables. There are companies, big and small, that are committing to sustainability. There are hospitals and health systems right here in the United States that have decided that they're not going to wait for change to come down from on high, but they have made commitments to go 100% renewable. They're planting trees and putting rooftop gardens on their hospitals so that they are living out the mission of protecting health, even as they take care of those individual patients who need them so much. Just think about the story of LEDs. You know, a few years ago when LED light bulbs first came out, they cost $40 or $50, and many of us said, wow, that's really neat, but that's really expensive. And yet people started buying them, and more people started buying them. And then all of a sudden today you can buy one for $2. And for the first time, more people are buying LED lights than incandescent light bulbs. And those lights, they're 90% more efficient, and they last forever. And just that small act of changing a light bulb, you multiply that by millions, and all of a sudden, we're reducing the energy uses of households across the country because they've switched their light bulbs. The most inspiring thing to me about LEDs is actually in the developing world, where you think, gosh, you know, this is a problem of those of us who have, and we need to fix it. But it turns out, if you think about, there are places where they are not on the electricity grid. And the only way they can have light is with a kerosene lamp. And that costs, if you're living on less than $1 a day, that's still costing 40% of your income. And it's causing pollution, and it's greenhouse gas emissions. But who are you? Because you have so little. And yet, for $10, an investment for a family for sure, but for the $10, you can buy a solar-powered LED lamp. And all of a sudden, there are millions of people who are among those most vulnerable, who most need us to take action on climate change. They're using a renewable light source. They're reducing the pollution in their homes and in their communities. And that's all possible because scientists and researchers came together and created LEDs and batteries, and they created ways for us to be able to distribute these across the world. There is so much that we can do, whether that is talking to members of Congress or deciding to walk instead of drive. There are actions that we can take, and they do matter. Just consider where we are right now. We're in the Kennedy room. Think about the fact that just over 100 years ago, there were a couple of guys in Dayton, Ohio, who were running, their two brothers, who were running a bicycle shop. And they thought, why don't we try to fly? And so in the back of their bicycle shop, they started building a plane. And they had no government funding, and they had no fancy backers. They just said, you know what, let's just try this. And they went outside and they looked at the birds, and they watched them flying around. They said, how do we do that? And in 1903, the Wright brothers flew for the first time, just because they believed that they could, even though man had been trying to for our whole existence. And then here we are in the Kennedy room. And one of the great achievements of the Kennedys was that moonshot. And that was only 66 years after the Wright brothers first flew their little plane. And all of a sudden we're putting a man on the moon. And what's inspiring about that is that a few people decided that we could achieve things that we could never, that other people said that's impossible. And the exciting thing to me about climate change is that we don't have to wait for a couple of guys in the back of a bicycle shop to have a brilliant idea and do it. And we're not waiting for a few brilliant astrophysicist scientists to come up with how do you escape Earth's velocity. We're talking about something that is everybody's job. All of us can play a part in getting us to a 50% reduction in greenhouse gas emissions by 2030 in 11 years. That we can get ourselves to a carbon neutral world by 2050. We can all play a part in that. And one of the things that we've talked about today is the partisanship. and the lack of willpower. But what can each of us do about that? It feels like, gosh, there are these big lobbyists and all this money that's being spent, and who am I? And as somebody who's spent a lot of time doing organizing and advocacy and convincing doctors that they have the power to change the world, one of the things that I've learned about people in power, the people who walk the halls of this building and the Capitol across the street, is that they're just a bunch of people, just like us. They listen to the people who are near them. They only know what they get to hear. And you may think that there's somebody else who's more qualified to bring that message to them, but that's not true. Because you're all here in this room, whether you participated in creating this brief or if you're here for the first time learning about it today, you have the power to change minds and hearts. And maybe not one meeting, maybe not two meetings, but it is through being there. It is through what Daphne was talking about, showing up. That's how things change. It's not through a poll. It's not through tweets. It's through actually being there and telling people who are in power, this matters, and I'm going to be here and tell you to take action until things change. You know, as we wrap this morning and as we go into this afternoon, I think many of us will be part of a brainstorming of how do we get the message out. I'd like for you all to imagine with me, and you can close your eyes if that's comfortable for you. Imagine that it is 11 years from now, and we're here in this room. It's 2030, and we have actually done it. We have actually created that change that we spent this whole morning talking about. Imagine it's 2050. It's 31 years from now, and we're all back here, a little bit grayer, a little hunched over. But instead of the worry that I know everyone in this room has right now, we are patting ourselves on the back. We're hooping and hollering because we've done it. We have transitioned to a new world, and our children have prospered, and they're living the lives that we want for them because of what we did. Now think about, what did you do to make that happen? What was your role in that? What was the role of this collective, all of us here in this room? How did we make it happen? That is the question before us today. So open your eyes. Let's go make it happen.
Thank you, Dr. Chen. On behalf of Dr. Hess and I, we hope that you are as inspired and motivated by this program as we were. But we also recognize we're standing between you and that food over there. Well, first off, we have some thank yous. So we want to thank each and every one of the speakers who came and shared your expertise and wisdom today. Thank you. Let's give them a round of applause, please. These projects truly take a village. So we have a village to thank, but don't worry, we aren't going to list everyone out individually. But first off, I'd like to thank Dr. Jeremy Hess, the senior author. Thank you for your mentorship and friendship through this. And to our core team, who put in many hours, evenings and weekends, because they passionately support this mission. I'm going to make you stand so you can ready yourselves. But Paige Knappenberger, who's an author and works at Climate Nexus and was huge between this, thank you. Jamie Shashansky at Climate Nexus, where are you? There you are. Kelly Foyafone from Harvard Global Health Institute. And Ellie Lehman, where is he? There he is, in the back. Thank you. And to the leadership of the Harvard Global Health Institute for supporting the logistics and coordination of this brief. I'm sure many of you have gotten emails from Kelly, so thank you for keeping us in line. It's been an honor and privilege to work with each of you day in and day out, so thank you. Dr. Cecilia Sorensen, there she is in the back, thank you. She helped coordinate the infographics, so thank you, and wrote this extended case study that I encourage all of you to read on outdoor workers. I also want to thank Dr. Georges Benjamin and the American Public Health Association, and really for their unending support of this brief and for this launch. And to our U.S. working group, to each and every partner that is out here in this audience. So we have over 50 organizations that support the working group. We had over 50 people review this brief. And it truly makes this the collaborative platform that it is to make sure that we highlight the breadth and depth of the expertise and passion that's in this room. So I don't have the time, and trust me, your stomachs will prevent me from listing all of your names, but thank you so much to each and every one of you in the audience and watching at home. And lastly, of course, we want to thank the Global Lancet Countdown. They had their launch today in London. So Dr. Nicholas Watts and he and his amazing team, Jessica Beagley, Alice McGushin, and Anjuli, all of them who really we worked closely with to coordinate this. Thank you. With that, I'll turn it over to Dr. Hess.
Thank you, Renee. Well, I'll start off with offering my hearty thanks to Renee for her outstanding work, her leadership, and her indefatigability, which was on evidence for the last several months and today. We'd like to thank Senator Schatz for his assistance in securing this august space. And we'd like to thank our sponsors, whose financial contributions made this event possible. Those include the American Public Health Association, the Harvard Global Health Institute, the Center for Health and the Global Environment at the University of Washington, Brown University School of Public Health, Emory University, the George Mason University Center for Climate Change Communication, the UCSF Institute for Global Health Sciences and its Global Health Group, the University of Colorado Consortium on Climate Change and Health, University of North Carolina Gillings School of Public Health, the Global Health Institute at the University of Wisconsin, and the Yale Climate Change and Health Institute. Please join me in thanking all of our sponsors. And we have a host of other brand sponsors that you'll note in the document. This work will continue with the working group meeting this afternoon. And of course, as mentioned, there are launches all over the world. And in the US, there are launches at Emory University tomorrow and at Yale and UCSF on the 21st. We want to thank you for your attention. Look forward to your fellowship over lunch and to your input this afternoon. Thank you very much.